Good afternoon, my fellow students. Sorry for some small delay. I needed to change the program I used for our translation. I hope you are fine as well as me, and I'm going to tell you about cranial nerves. That will be the second lecture for cranial nerves. Please let me know how you hear me. Yes, I see 3 persons only. As usual, that is typical for our lecture. I don't know why, because you will pass the exam in March. Okay, thank you, and I will open presentation. I am opening presentation now. Okay. Well, so cranial nerves. We will discuss today 6 pairs of cranial nerves from 7th to the 12th. And let me remember you that 7 cranial nerves we called facial nerve. Yes. Then here you see 2 parts of facial nerve. Facial nerve and the additional nerve. Sometimes we call this nerve intermediate nerve. The cranial nerve number 8, vestibulocochlear nerve, then glossopharyngeal nerve, here vagus nerve, accessory nerve, and hypoglossal nerve. All of this nerve we will discuss today. And we start from facial nerve, the cranial nerve number 7. In Latin, we call this nerve nervus facialis. Let me remember you the origin, the development of the facial nerve. We discussed it last lecture, but let me repeat it again. You see this cranial nerve, and it is connected with the second visceral arch. Sometimes we call this arch hyoid arch or hyoid arch, and everything what was developed from the second arch is innervated by facial nerve. That is the picture illustration of cranial nerve, and if we take a look to the composition or fiber composition of this nerve, I'd like to tell you that this nerve is mixed nerve. It contains sensory, motor, and autonomic fibers. Sometimes we call these autonomic fibers as parasympathetic fibers. Actually, this nerve is complete, and it is not easy to understand every function and every connections of the facial nerve. This table is completed information about facial nerve, and as I said, facial nerve is mixed nerve and content mixed fibers. It is visible here, and you see also that function of the facial nerve is sensory, is taste. Then it innervates almost all facial muscles, and plus it is responsible for innervation nasal, oral, and some two large salivatory glands. The sensory neurons monitor proprioceptors in the facial muscles. They provide deep pressure sensation over the face, and the nerve receives taste information from receptors along the anterior two-thirds of the tongue, and somatic motor fibers of the facial nerve innervate the superficial muscles of the scalp and face, and some deep muscles near the ear, as well as three muscles in the neck region. Next slide show the nuclei and ganglion of the facial nerve. Here we use the same principle when what we used last lecture, and show motor nerves in red, sensory sensitive nuclei with blue, and we use green color to show visceral or parasympathetic nuclei. Here you see that this red nuclei we called facial nucleus, or it is motor. Then long nucleus called nuclei of solitary tract. It is sensitive. It is common for 7th pair of nerves, as well as for glossopharyngeal and the nerve number 9, and for vagus nerve, the nerve number 10. And the visceral or autonomic nuclei called lacrimal, it is small nuclei here visible, and quite large superior salivatory nucleus. They are responsible for lacrimal gland, small lacrimal nucleus, I hope you guess, is responsible for lacrimation, and superior salivatory nucleus salivatory show that this nuclei is responsible for innervation salivatory glands. And all these nuclei, all nuclei of the facial nerve located in the pons. This is the part of the cerebral trunks, and the facial nerve is the nerve of is the pons nerve. The origin, the place where the facial nerve exits the brain, is located between pons and medulla oblongata. That is the border of the this is not bridge, this is my mistake, it's pons and medulla oblongata. You see here a yellow color, this is the facial nerve. Depends on the another idea that take in consideration that nuclei of the facial nerve are located in the pons, but it exits the brain between the pons and between the medulla oblongata. Okay, this is the cranial. This picture, this figure shows us a cranial passage of the facial nerve, and this is a large foramen. We call it internal acoustic meatus. This is the cranial pathway for facial nerve as well as for vestibulocochlear nerve. This nerve we designate as number 8. We will talk about vestibulocochlear nerve later. Facial nerve pass through the skull in facial canal. This is a structure inside of temporal bone that is quite complicated and curved canal, and the beginning of the facial canal start from the internal acousticus meatus acousticus internus, and the end of the channel is in stylomastoid foramen. As you see, this canal has 3 parts: superior, middle, and inferior, and there are 2 turns. First turn is at the level of this is here. This first turn is here. That is at the level of geniculate ganglion, where geniculate ganglion is located. And second curve or turns is at the level of inferior wall of tympanic cavity. In the facial canal, facial nerve has 3 branches of, and first of all, I'd like to see you this ganglion. This is small ganglion in the facial canal. It is here, and as you see, this is sensory ganglion. It is responsible for the taste sensitivity and transmits impulses to the sensory nucleus. This is the nucleus of solitary tract in the pons, and it is nicely see the turn of the canal at the level of geniculate ganglion. We distinguish 2 group of the branches of the facial nerve. The first group, that is the branches inside the facial canal. But the second group, facial nerve, has after leaving the facial canal, and that is visible. All branches in facial nerve canal, we will discuss this figure, and you see three main branches of the facial nerve inside the facial canal. First one is called greater Petrosal nerve. It is green here. It is green because this nerve, this branch, is autonomic or parasympathetic branch. Then the second one is stapedial nerve, small one. It's visible here. It is red because that is the motor fibers come to the small muscles called stapedial, the same name. And the third branch is called chorda tympani. This is blue and green because it contains this nerve, this branch has the sensory fibers and parasympathetic fibers as well. So this is combined sensory and parasympathetic branch. First branch called great Petrosal nerve leave the facial canal. Here you see this facial canal, and small nerve, a small branch of facial nerve, designated number 3, that is a greater Petrosal nerve. As you see, this nerve passes through opening called hiatus for greater Petrosal nerve, and then it is located in the groove for the great Petrosal nerve. All of these structures are located in the anterior surface of the pyramid of the temporal bone. Where the greater Petrosal nerve goes, it reaches the top of the pyramid and then passes through the skull through the foramen lacerum. This is an irregular and quite large foramen in the basis of the skull. The nerve follows to the pterygoid canal. Here you see the pterygoid canal, and come into the Pterygopalatine fossa, where this nerve form Pterygopalatine ganglion. So Pterygopalatine ganglion, it is visible here. This is, let me show it again. This is the Pterygopalatine ganglion, and this ganglion contains neurons of the parasympathetic system. That is the second neuron of the visceral innervation. Some of the glands in our head, lacrimal glands, the glands in the nasal cavity, and small oral cavity salivatory glands. So the great Petrosal nerve responsible for innervation mostly glands located in the upper part of our head. First of all, this is lacrimal glands, then nasal cavity glands and mucosal glands, and small salivatory glands in the oral cavity, in the upper part of the oral cavity. Here visible the diagram and scheme of the great petrosal nerve, and it is visible how it starts from the canal, this one. It comes into the in the canal, pterygoid canal, and reach the Pterygopalatine fossa. Here you see the Pterygopalatine ganglion, and in this ganglion the black dots are the neurons in the ganglion, where postganglionaric parasympathetic fibers follow to the three glands: lacrimal glands, the small nasal glands secreting the mucosal the fluid on the surface of the mucosa of nasal cavity, and this is the palatine glands in the oral cavity. So I hope now it is clear what is the function of the greater petrosal nerve. This ganglion, Pterygopalatine ganglion, is located very deep in the skull, and it is not easy to dissect and see this ganglion, but it is possible if we use special technique. For example, it is easy to see ganglion when we use plastination section of the head, and then step by step we come to the Pterygopalatine fossa and see small Pterygopalatine ganglion inside. As I said, this ganglion is responsible for innervation palatine and buccal salivatory glands, glands of nasal mucosa, and lacrimal glands. 1, 2, and 3 group of the small actually lacrimal gland is not small, but not such it has not big size, and all of these glands are located in the orbit, nasal cavity, and oral cavity. The second branch of the facial nerve, called stapedial nerve. It is really small. If you take a look at this figure, you see small and thin fibers started from the facial nerve and come into the stapes muscle. This is stapedius, sometimes we call this stapedius muscles. It's connected to the stapes. Stapes, this is a small bone here, small bone in the tympanic cavity, and this nerve is responsible for innervation these muscles. And what is the function of these muscles? When the sounds we hear very deep and strong sounds, the stapes starts to vibrate very much, and it is painful. So the muscles, stapedius muscles, contract and fix the stapes, reduces these extra vibrations. Next, or third nerve, or third branch of the facial nerve, called chorda tympani. It branches in the inferior part of the facial canal before the nerve exit from the stylomastate foramen. Here is the stylomastate foramen, and you see this branch called chorda tympani. It is its name is strange, but if you see how this nerve comes through the tympanic cavity, you see that it is like a chorda. Chorda, it means some cord or small nerve which is visible inside of tympanic cavity. So the name is that, but the nerve exits the skull through pterygotympanic fissure. This is the name of small fissure in the between tympanic and tympanic part of the temporal bone, and between the pyramid of this bone, and then it goes to the ganglion. This is the ganglion named submandibular ganglion, where located second neurons, parasympathetic second neurons, which innervate two glands, sublingual glands and submandibular glands. But also the sensitive fibers pass through the submandibular ganglion and come into the tongue. These fibers are responsible for the taste. They conduct taste impulses from the anterior 2/3 of the tongue. If you see, the tongue has this area. It is about 2/3 of the tongue, and it is innervated with the chorda tympani, and this sensation, this sensory, is taste, not common sensitive, not pain, not the tactile sensory, but only taste impulses follow through the chorda tympani. And you see here branches, this external part of the facial nerve located after it leaves stylomastate foramen. Here you see this is the same figure, and this is the stylomastate foramen, and some of small nerves, 3 nerves branch from the facial nerve right after it leaves stylomastate foramen. What kind of nerve we are talking about now? This is the posterior auricular nerve that is here. It follows to the muscles of the auricula, of our auricula, and to the occipital belly of the epicranial muscles. Second branch is this is the digastric digastric branch. It is here, and it innervates posterior belly of digastric muscles, and small branch called styloid branch are responsible for innervation styloid muscles. So three muscles, no, not three, but about 5 muscles located on the surface of the head and inside of the head. They are innervated by small branches after facial nerve exit the skull. And another branches. This is the branches located. Sorry, here you see these branches are located superficially and form a parotid plexus. It means these nerves located inside of parotid glands, and all of these branches innervate mimic muscles or facial muscles. What kind of branches we distinguish in parotid plexus? The first branches called temporal branches. They are here. They go to the upper facial muscles. Then we could find zygomatic branches. They are here and here. They come to the third or middle part of the face muscles, and buccal branches as well. More often we could find not only buccal branch, but sometimes 2, 3, sometimes 4 buccal branches. The branch called Imaginal mandibular branch, let me show it here, goes to the anterior part of the mandibula and innervate usually muscles located in the inferior part of the face. This is the muscles we use by talking. They connect to the lips and oral angle, etc. And the fifth branch of the parotid plexus called cervical branch. Cervical branch is responsible for innervation the platysma. This is the muscles located under the skin in the neck region and as well as in the lower part of the head. You see the template shows and helping you to understand and remember the branches of the facial nerve: temporal, zygomatic, buccal, mandibular, and cervical. It is the template to for better memory how facial nerve branches are named. All of the external branches are responsible for innervation muscles. Facial muscles, platysma, that is superficial muscles in the neck region, posterior belly of the gastric muscles, and styloid muscles. You see here, this is the platysma, splatysma. Then you see the posterior belly of posterior belly and stylohyoid muscles here, and all of these muscles, this one, this is the facial muscles located under the skin, under the face skin or skin of the face. Summarizing the function of the facial nerve, please take in consideration that is the sensory neuron, because it is responsible for the taste sensitivity. It is responsible for lacrimation, runny nose and salivation, and it is the nerve innervates the facial muscles as well as small muscles in the neck and inside of tympanic cavity. Again, let me repeat again that the part of the facial nerve with parasympathetic and sensory fibers, I mean this part, sometimes is called the intermediate nerve or 13th cranial nerve, called nervus intermedius in Latin. A couple of clinical information. This is the level of damage to the facial nerve. The damaged facial nerve external in the level of the parotid plexus after the nerve leaves the facial canal. It follows to the peripheral motor paralysis of facial muscles that sometimes called Bell's palsy. When here this is the half of the head for this woman. This woman has the Bell's palsy when all external branches of facial nerve were damaged, and that is really tragic because denervated muscles look like mimic face mask. It is not possible to close the eyes. It is no wrinkles. Sometimes it is good for women, but not in this chance. Usually because of the eyes is open, we see lacrimation symptom. It is difficult to speak, sing and whistle even, and sometimes the fluid come out from the mouth cavity, and that is also a problem for patients has such damages called Bell's palsy. Another level, it is up to the stylomastoid foramen. When it is up to the chorda tympani branch, then for all of symptoms I described before, another two symptoms come for this damage. This is the loss of the taste sensation, because no possible to get information from the taste follicles in the oral cavity, and this is reducing production, decreases production of the salivatory glands. Then another level, this is the level number 3, is the damage to the facial nerve above the origin of the stapedial nerve. Additional symptoms will be abnormality, acute hearing. Sometimes it is a painful sensitivity sensitivity of the sounds, and the most difficult damage is damage number 2. This is second level, where nerve just come into the facial canal, and you will get all of symptoms described before, plus xerophthalmia. This is when no teeth and no lacrimation, and this patient will have dry eyes on the damaged side. Next nerve we will discuss in our lecture. That is the vestibulocochlear nerve, or cranial nerve number 8. Then this nerve consists of two parts, and the first part, it is visible here. This is the first part, and we call it cochlear nerve. It is responsible for auditory sensitivity, and the second part, called vestibular nerve, is responsible for statokinetic analyzer. You see that this nerve is a sensory nerve, and the most important function is the hearing and equilibrium. Equilibrium means how people can keep your body, and how then manage to keep the equilibrium, or statokinetic receptions. Where located this nerve? It starts from inner ear. This structure inside of pyramid of the temporal bone, called inner ear, and the nerve start from two parts of the inner ear, and join together and form the vestibulocochlear nerve. The nerve leave the cranium in internal acoustic meatus, the same point where located facial nerve. They are going together. They go together and leave the skull in the same point, internal acoustic meatus. And this is another figure, show the two parts of the vestibulocochlear nerve. This one is the vestibular nerve. It go from the receptors of the ganglion located inside of internal meatus, acousticus meatus, and the second part of the vestibulocochlear nerve is cochlear nerve. So when we combine together vestibular and cochlear, we get vestibulocochlear nerve. That is a pair of cranial nerves number 8. Here you see the meatus acousticus internus, and then you see also the facial nerve here, and vestibulocochlear nerves terminate in the pons, between medulla oblongata and pons. This is the same place where we find facial nerve. Next slide shows us the ganglia of the vestibulocochlear nerve. And you see that vestibular ganglia distinguish into the superior part and inferior part. But the ganglion inside of cochlea, this is a quite interesting shape of this is a spiral shape, and then we call this ganglia as a spiral ganglia, and they join together and form the vestibulocochlear nerve. What kind of nuclei we see which are get information from inner ear, from the ganglion? You see here ganglion, spiral ganglion and vestibular ganglion, and the fibers come into the pons and form and end on two group of nuclei. Cochlear nerve ends in the cochlear nuclei. Usually there is two nuclei, anterior and posterior cochlear nuclei, but vestibular nerve ends in four nuclei. We call them vestibular nuclei, and there are medial, superior, inferior and lateral vestibular nuclei. This show us the auditory pathway, how we get sensory information from the cochlea and how we hear. Right now, I hope you are hearing me, and the auditory pathway helps you to understand what I'm saying. And this is the pathway. Start from the cochlear nuclei. You see it; they are located in pons. And then it forms the lateral lemniscus. This is the pathway to the thalamus, where located the third neurons. And then from the thalamus, the axons of the thalamic neurons come into the temporal gyri and form center of the hearing. So the auditory pathways consist of four groups of neurons. First neurons are located in the spiral ganglia of the cochlea. Then second neurons, they are cochlear nuclei of the pons. Then the third nuclei are located in thalamus, and the center, projection center, are located in the temporal lobe of the cerebral cortex. Equilibrium pathway. It also has four groups of neurons. First neurons are located in the vestibular ganglion. Then second neurons, they are vestibular nuclei. They named after four scientists, for neurologists: Bechterew, Roller, Schwalbe and Daters. Or More often we call them upper nuclei, lower nuclei, superior and inferior, medial and lateral nuclei. Then the fourth neurons are located on thalamus, or sometimes vestibular nuclei have a lot of connection with the motor neuron of the spinal cord, as well as for the some of the cranial nuclei of the oculomotor, trochlear and abducens nerve, as well as accessory nerve. Almost 4 cranial nerves are connected with the vestibular nuclei, and it helps to combine movements of our eyes with the contraction of the neck muscles. And the cortical pathway go through the thalamus. It contains the third neurons located in central nucleus of the thalamus, and the center vestibular area or vestibular projection center are located in the temporal lobe of the brain. Here, this clinical test for identification disorders of the vestibular pathways, and they call Romberg test, very famous test used since 1846, and usually we use it to see doctor use this test to examine patients with vestibular disorders. And the second test, called Babinski Whale test, it is younger than Romberg test, and usually this is when patient close the eye and try to walk, the path will be formed like a star, shape star, because it is not possible to go direct and back. So the pathway will be look like a star. Glossopharyngeal nerve, number 8. As you see from the name of this nerve, it is responsible for the tongue innervation as well for the pharyngeal. The glossopharyngeal nerve is a mixed cranial nerve, and it innervates the tongue and pharynx mostly. The glossopharyngeal nerve has mixed fibers, sensory, motor and parasympathetic, but sensory fibers are most abundant. The sensory neurons are in the superior ganglion and the inferior ganglion of this nerve, located at the level of jugular foramen. The afferented fibers carry general sensory information from the lining of the pharynx and the soft palate to the nucleus in the medulla oblongata. This nerve, glossopharyngeal nerve, also provides taste sensation from the posterior third of the tongue. Additionally, the glossopharyngeal nerve has special receptors monitoring the blood pressure and dissolved gas concentration within major blood vessels. The somatic motor fibers innervate the pharyngeal muscles involved in swallowing. Visceral motor fibers of the glossopharyngeal nerve synapse in the otic ganglion and postganglionaric fibers innervate the parotid gland of the cheek. Here you see nuclei of the glossopharyngeal nerves. There are three nuclei. First nuclei called nucleus ambiguus. It is here. It is motor. Then blue nucleus. Here it is not blue. It is green. But this is a mistake of the atlas, I hope. We call this nucleus nucleus of the solitary tract, and this is sensitive nucleus, and it provides gustatory sensitivity and taste sensitivity of the posterior third of the tongue. And the third nuclei called inferior salivatory nucleus, as you guess, I hope you guess, that is responsible for secretion of parotid gland, salivatory gland, one of the biggest salivatory gland in our body. Here you see brain exit of the glossopharyngeal nerve. It is located just under the vestibulocochlear nerve, and this sulcus called posterolateral sulcus of the medulla oblongata. You see this nerve here. This is a glossopharyngeal nerve, and it is located quite close to the pons, but it starts from the medulla oblongata. Cranial passage of the glossopharyngeal nerve called jugular foramen, and this opening for three cranial nerves, number 9, number 10, and number 11. So all of these three nerves pass through the skull in the jugular foramen. Here you see branches of the glossopharyngeal nerve. First branch called tympanic nerve, that is here. Then branches to the vagus nerve. Here you see this branch to the vagus. Then tonsillar branches innervates tonsilla palatina here. Lingual branches are responsible for the common sensory and test sensitivity of the dorsal third of the tongue. Pharyngeal branches go to the muscles of the pharynx, and the small and thin branches go to the glomus caroticus or carotid sinus, that is responsible for getting information about our blood pressure and about concentration of carbon concentration in the blood, in our blood. Tympanic nerve start from the glossopharyngeal nerve right after the jugular foramen, and then return back through the mastoid canal and come into the tympanic cavity, where it innervates the mucosa of the tympanic cavity, and then go up and exit the cranial in the hiatus nervi Petrosi minoris, or minor Petrosal nerve. This nerve is parallel to the greater Petrosal nerve, come into the, we call it lesser Petrosal nerve, and then it goes to the otic ganglion. You see here, this is tympanic nerve. It forms the tympanic plexus, innervation, mucosal cavity of the tympanic cavity, mucosa of the tympanic cavity. Then the lesser petrosal nerve form otic ganglia, and postganglionar fibers innervate the parotid glands. So glossopharyngeal nerve is a nerve which send impulses, motor impulses, visceral motor impulses to the parotid gland, and parotid gland start to secrete salivatory fluid. The common function, or all area innervated by glossopharyngeal nerve are visible here. This is the, first of all, this is the common sensitivity of the tongue. The glossopharyngeal nerve is responsible for sensory information from the pharynx, auditory tube. Here you see auditory tube. The mucosal of the pharynx and auditory tube are innervated by this nerve. It also provides taste sensation from the posterior third of the tongue, as well as the common sensation of the posterior third of the tongue. The motor fibers innervate of the glossopharyngeal nerve motor fibers innervate stylo-pharyngeal muscles, only one muscles, quite small, started from the styloid processes, and visceral fibers, synapses in the otic ganglion, and postganglionic fibers innervate the parotid gland, the biggest gland, salivatory gland in our body. Here you see gustatory pathway, how the impulses from the test receptors go to the brain. As I said, the anterior 2/3 of the tongue were innervated by facial nerve, but posterior area of the tongue were innervated by glossopharyngeal nerve. Even 10 pair of cranial nerves called vagus nerve innervated small structure in larynx called epiglottis. On the anterior mucosa of the epiglottis also located taste receptors. So all of this information come into the gustatory nuclei. They call, in other words, they call nucleus-solitary tracts, and then it goes through thalamic. So this is the second neuron, and come into the primary gustatory area of the lobus, frontal lobe of the cerebrum. The longest and maybe the most important cranial nerve called vagus nerve. That is the pair cranial nerve number 10. Why this nerve is so important? First of all, this vagus nerve has a variety of functions. This nerve is mixed and it contains sensory, motor and parasympathetic fibers. The vagus nerve arises immediately inferior to the glossopharyngeal nerve, and as its name suggests, vagus means wanderer. The vagus nerve branch extensively. This figure shows how only the general pattern of distribution. Sensory neurons are located with the superior jugular ganglion here, and the inferior or nudus ganglion. So there are two ganglions, superior and inferior ganglion for the vagus nerve. As you see, the function, the list of function is as long as my arm. So this is a sensory, taste sensation of the hunger or fullness and gastrointestinal discomfort. The nerve provides swallowing, speech, deceleration of hair, of heart, bronchoconstrictor and gastrointestinal secretion and motility. So it is very important nerve, as you see from its function. And we could find this nerve everywhere, in the head, on the head, in the neck region, in the chest, and even in the abdominal cavity, where it innervates a lot of internal organ of abdominal cavity. This is a mixed nerve, and that's why it has three kind of nuclei. Motor nuclei called ambiguous nuclei, nuclei of the salivary tract, that is a sensitive nuclei, is common for the 7th and 9th pair of cranial nerves, and dorsal vagal nuclei, it is here located. That is a parasympathetic center, parasympathetic nuclei for innervation all chest and abdominal organs. Where the vagus nerve exists, the brain, that is low to the glossopharyngeal nerve, and you see the vagus nerve is large and thick. That is really thick, one of the thick cranial nerves. It is located here. Its nuclei are located in the medulla oblongata. That is the medulla oblongata cranial nerves. The cranial passage of the vagus nerve is the same as the passage for glossopharyngeal and accessory nerve, and it is jugular foramen. Here you see the two ganglion of the vagus nerve, superior and inferior ganglion, and here is also visible here, superior and inferior ganglion, and we distinguish four group of the branches of the vagus nerve. The first group, number 1, is the branches we can see on the head. That is the meningeal branch, first one. It innervates the dura mater of the brain. Then auricular branch, it is responsible for the skin of the auricula, and communicating branch, which join and close and joint glossopharyngeal nerve. So glossopharyngeal nerve and vagus nerve, they are very have common function, and because they combine their fibers on the head. Cervical branch, that is the second group of vagal nerve. We distinguish pharyngeal branches, innervated pharynx, then superior laryngeal nerve, it comes into the larynx and innervated muscles and mucosa of the larynx. Then some of branch go to the heart, and we call them superior cervical cardial branches as well as inferior cervical cardial branches. And in the chest, the vagus nerve branch, recurrent laryngeal nerve, it comes back to the larynx and innervated most part of the internal muscles of this organ, I mean larynx or laryngeal muscles. Thoracic branches, they innervate the heart. Then we call them thoracic cardial branches. A lot of branches from the vagus nerve come to the bronch tree and innervate bronchus, and also it innervates esophagus. So it is responsible for the sensitivity and motility of the esophagus. Abdominal branches we distinguish in the posterior trunk and anterior trunk, and this nerve innervated almost all organs of abdominal cavity except transversal colon, except of descendant colon and sigmoid colon, and this nerve doesn't innervate organ in the pelvic cavity. So really this nerve, it is true to call this nerve vagus because this nerve we could find everywhere, on the head, on the cervix region, on the neck, in the chest, and even in the abdominal cavity. As you see, a lot of function. In the neck, it is innervated pharynx and larynx, innervated the skin of the auricular and meatus acousticus externus. It innervates epiglottis, the part of larynx, innervate heart, innervate the posterior dura mater in the posterior cranial fossa, and all of illustrated, all of abdominal and chest organ illustrated and are showed here in this picture. Interesting symptom we may see in patient when examine patient with the problem with the disorders of vagus nerve. This is of course this is a deviation of palatine uvula, and if you see patient with such shape of the usually uvula are have symmetric, but if it is deviate to the other side, it means that this patient may have damages of the vagal nerve. 11th cranial nerve called accessory nerve, that is number 11, and this nerve is responsible for innervation only two muscles located on the neck. Accessory nerve differ from other cranial nerve because some of the motor fibers originate in the lateral portion of the anterior horns of the first 5 cervical segments of the spinal cord. These fibers from each accessory nerve form the spinal root. Here you see spinal root of the accessory nerve. It's joined with the cranial root together and form this pair, this nerve called accessory nerve. The spinal root enters the cranium through the foramen magnum. Once within the skull, the spinal root unites with the motor fibers of the cranial root. The cranial root originates at the nucleus in the medulla oblongata and leaves the cranium through the jugular foramen. They combine together, and each accessory nerve consists of 2 branches. The internal branch joins the vagus nerve and innervates the voluntary swallowing muscles of the soft palate and pharynx and the intrinsic muscles that control the vocal cords. But the second branch, this is the external branch of the accessory nerve, innervates the sternocleidomastoid, and here you see these muscles, and as well trapezius muscles. That's why we call accessory nerve responsible only for muscle innervation, but telling the truth, this nerve is also responsible for swallowing and soft palatal innervation, because its branch come into the vagus nerve, where then innervate these muscles in soft palate and pharynx. Here you see the external branch of innervating the trapezius and sternocleidomastoid, and this is the nuclei inside of spinal cord and medulla oblongata, and all of these nuclei are motor nuclei. The termination of the accessory nerve, that is a 2 termination in the medulla oblongata and in the cervical segments, usually from 1 to 6 cervical segment. But cranial radix or cranial path is located in the posterolateral, in the inferior, in the posterolateral sulcus, right below the exit of the vagus nerve, and the same cranial passage as for the glossopharyngeal and vagus nerve, that is the jugular foramen. This is a place where accessory nerve leave the skull. And here you see again a function of accessory nerve. But the last nerve today is cranial nerve number 12. We call it hypoglossal nerve, nervus hypoglossus in Latin. You see this nerve start from the ventrolateral sulcus and go into the tongue. This is only motor, it has only motor fibers. This nerve is a motor nerve, and control this nerve control over movement of the tongue. You see nuclei, only one nuclei located in medulla oblongata and called hypoglossal nuclei. This is the exit of the hypoglossal nerve from the brain, exit brain point of this nerve, and this sulcus called ventral or anterolateral sulcus. It pass the skull through the hypoglossal canal. It is in the base of the processes, condylar process of the occipital bone, and the nerve come to the tongue and innervate all muscles of these organs. And symptom when this nerve is damaged, you see the deviation of tongue to the contralateral point. It means that the nerve for this patient, if you see such deviation, it means that the right hypoglossal nerve is damaged, not left but right. This is all for now, my friend, and I, as usual, thank you for your attention. And as usual, I am ready to answer your questions. Please put your question here, and I will be glad to answer every question you have. I see no questions. It means that everything is clear today. Okay, thank you also, and I wish you, as usual, good health and good luck in studying cranial nerves. Next lecture will be about sensory, about eye and auditory sensory, and we have 2 lectures for the next 2 weeks. Thank you for your attention, and hope to see you again, not see, but I hope to meet you again in our human anatomy course. This is all for now. Let me say goodbye and close our connection.